All right, well, we'll get started. Well, good evening, everyone. So happy that you've joined us for this wonderful webinar that we're about to produce. I am Wanda Wright, and I'm the director for the Office for Veteran and Military Academic Engagement, very long title. We have an office at Arizona State University, and one of our pillars is to do community engagement. And we like to be sort of the bridge for education for our veteran students and the community. And so tonight we have special guests with us from Veteran Health Services at the Veteran Health Center in Phoenix. And I'm going to let them introduce themselves, and then we'll talk about women healthcare. So Kristen, go ahead.
Sure. Hi. Thanks, Wanda. My name is Kristen Nordquist, and I'm a licensed clinical social worker at the Phoenix VA. I've been at the VA Medical Center for the past 20 years, and in my current role as the Women Veterans Program Manager for the healthcare system since 2013. And I'm very honored to be here tonight speaking with you. Thank you.
Great. Thanks, Kristen. Megan.
Evening. I'm Megan Giblin. I am the Assistant Women Veterans Program Manager here at Phoenix VA. I'm also a licensed clinical social worker, and I have been in this role for about 3 years and with the Phoenix VA for about 4.
Thank you, Megan. All right, Dr. Kennelly.
Hi, my name is Colan Kennelly. I'm a family physician by training, so primarily focused on primary care. I've been with the Phoenix VA for a little over 8 years, and I've been the Women's Health Medical Director for about 6 of those years. And in that role, this is on a later slide, but what I do is help to optimize and improve the care for female veterans, the care that's delivered through the primary care clinics. So I don't oversee gynecology, but I try to improve care for female veterans in the primary care clinics.
Great, thank you. All right, so I think I'll sort of lead off with this question, because I do believe that women veterans don't really understand how much care is at their healthcare center or system. And so talk to us about what is comprehensive health care for women veterans at the VA.
So Wanda, that's a great question, and thank you for leading us off with that. And before we get into that, though, we do want to go over a little bit of a roadmap for where we're going to go today. So we will get into comprehensive primary care for women veterans. And when we talk about healthcare services for women veterans, we're talking about birth sex female veterans and veterans who self-identify as women. So today, what we'll be doing is reviewing statistics of women veterans, and also because healthcare services is such a broad topic, today we're going to focus on comprehensive primary care, whole health, gender-specific specialty care, reproductive health care, and mental health care. And now I'll turn it over to Kristen.
All right, thanks, Megan. So women veterans are the fastest growing veteran population. 30% of all new VHA enrollees are women. This graph shows how the number of women veterans who are utilizing Veterans Health Administration for healthcare has increased from slightly over 300,000 in 2010 to over 650,000 in 2023, which is over a 100% increase in just 13 years. By the end of fiscal year 2030, the VA projects that 1.12 million women veterans will be enrolled, which will account for 12.6% of the veteran enrollees. Women veterans are the fastest growing demographic and currently comprise 11% of the total veteran population, which is also reflected locally. So this slide represents those women veterans who are enrolled in the top line, nearly 13,000 women veterans who are enrolled currently in the Phoenix VA healthcare system as of the end of fiscal year 23. And then the bottom line represents the users. So these are the number of women veterans who are enrolled that have used VA healthcare services within the past 2 years. So if you look at fiscal year 23, it was nearly 12,000. So that is 91% of women veterans are using Phoenix VA healthcare services.
Wow, that's incredible, really. I think we're going to take a moment here to do a poll and see how many of our audience are enrolled in the VA. Wow. All right. Well, looks like we got 71% of our group is enrolled. So my hope is that those that are enrolled have some sense of what the VA is, but those that aren't, I hope you get a good understanding of what the VA offers and then enroll. All right. Thanks, Stacy.
Okay, so before we get into the healthcare services, I want to talk a little bit about the role of the Women Veterans Program Manager and the Women's Health Medical Director. So the Women Veterans Program Manager assesses the need for and the implementation of services for eligible women veterans and provides leadership and oversight to ensure that identified needs are met at the facility. The Women Veterans Program Manager reports directly to the Chief of Staff or the Deputy Chief of Staff. The Women's Health Medical Director serves as the clinical leader for the women's health program at the facility level and maintains an active clinical practice in women's health as a women's health primary care provider. Together, the Women Veterans Program Manager and the Women's Health Medical Director form the foundation of the Women's Health Program and work to ensure timely, equitable, high-quality, comprehensive care services are provided to women in a sensitive and safe environment. So as we previously explained, I'm the Women's Health or the Women Veterans Program Manager. Megan is our Assistant Women Veterans Program Manager, which is typically recommended for facilities that have over 10,000 women veterans enrolled. And then Dr. Kennelly is our Women's Health Medical Director.
I'm going to interrupt just for a second. I just want to let everyone know that you can ask questions. We have a Q&A at the bottom of the screen. So if you have any questions, we'll try to interject them as everyone's speaking about the medical subjects.
So I wanted to take a moment and just discuss what is comprehensive primary care. One thing I hear from patients often as a primary care provider is a false belief that the VA only takes care of service-connected conditions, that will only address things that are a result of military service. But for those who qualify for VA care, we provide comprehensive health care. So in the primary care clinics, yes, we take care of service-connected conditions, but we also take care of anything you need, basically. We try to be the first stop for any medical needs and hopefully the last stop. But we also have some specialists we can work with, which I'll talk about in a moment. But primary care providers, we try to do as much as we can for our patients. So that can include, but is not limited to, disease screening, which we'll talk about in a little more detail in a later slide, vaccination, management of chronic diseases, contraceptive management, and various reproductive health services, which we'll also talk about later, the diagnosis and treatment of acute diseases. So when people have something new, a new injury, a new illness, we talk to them and try to help them out. We do have specialty clinics as well. Like I mentioned, Phoenix is a larger facility, so we have quite a few specialty clinics. We do try to address as much as we can within primary care because we have kind of a top level, high level view of our patients. We know our patients very well, and we can provide good care because we have that sort of comprehensive view. But for some of the more specialized conditions, things that might require a specialist, once we've met the prerequisites for a consult, which often involves certain diagnostic testing or attempting certain treatments through primary care, we can also consult the specialty clinics. So we will send folks off if there's something a bit more complicated or if we need assistance. So if you are enrolled at the Phoenix VA and you do have any healthcare needs, whether it be prevention or treatment of acute or chronic diseases, please reach out to your primary care provider and we will do everything we can to get your health as optimized as possible.
So please note that the services for women veterans at the VA extend far beyond what we're reviewing today. This slide represents just a few of the services that are available to women veterans that may surprise you. So we'll pause for just a minute to let you review.
And you'll also get copies of these slides as well. So if that was not enough time, you'll be able to go back and review that as well. So briefly, we also want to share a little bit about whole health. And whole health is the VA's approach to care that supports your well-being by shifting the focus from what is the matter with you to what matters to you. Instead of only focusing on the problem, the focus expands to explore what matters to you, what you want from your healthcare, and why. So whole health aims to address your individual needs and also recognizes that there are many factors that create the person that you are and influences your health. And Kristen will explain a little bit more about those factors.
All right, so please note that on the screen now you're seeing the circle of health. And the circle of health shows you in the middle with your care options surrounding you. This helps you to explore connections between important aspects of your life and your health and well-being. So please note that there are 4 key elements. In the center is me. So you are the center of your care. And you want to think about like what matters to you. Self-care is those areas in the green circles surrounding me. We each have the power to impact our own well-being. Self-care is any activity that you do purposely to care for your mental, emotional, and physical health in between your medical appointments. And then the next circle, the dark blue circle, is the professional care. So this is your healthcare team, which is there to help with the prevention and treatment of disease or illness, either using conventional or complementary medicines. And then finally, in the exterior circle is the community. Your community is the people and the groups that you connect with. So all of these have an impact on your overall health. Whole health care helps you to consider your goals, your areas of strength, and aspects where more support could be helpful. And our whole health program is available to help you get started.
So what you see on this slide are our current offerings at Phoenix VA for whole health programming. As you can see, there's quite a variety of offerings, and whole health is actually at all VAs across the system, and offerings will change depending on where you are in the healthcare system. However, I encourage you to reach out and find out what's available near you if you're not part of the Phoenix VA healthcare system. And on these flyers, you have information on how to secure message to get involved in whole health or call as well. And up at the top of the screen next to the whole health is an app. Actually, that's what the app looks like. It's called Live Whole Health. So you can even try out whole health on your own if you're just curious about it. And it's on Android and iPhones.
Now I'd like to focus on gender-specific specialty care. Although women veterans may receive routine gender-specific preventive care from their women's health primary care provider, they do have the option to be seen in gynecology for both routine and specialty gynecology care. In addition to routine well-woman care, including pap smear screening, gynecology also addresses many specialty concerns. At this time, specialty gynecology services are offered only at the Carl T. Hayden VA campus on 7th Street and Indian School in the Amethyst Clinic. So the gynecology department consists of 3.6 full-time gynecologists, 1 full-time gynecology nurse practitioner, and 1 OBGYN resident. Our gynecologists provide minimally invasive surgery, including laparoscopic and hysteroscopic, as well as robotic surgery. They also can help with prescribing contraception and providing contraception, doing any screenings for sexually transmitted infections. They also do colposcopies, so in-house procedures, as well as treat abnormal uterine and menstrual bleeding disorders. Fibroid management, they also address endometriosis. And for those who are experiencing menopause or perimenopause, they do have services there as well as offering a biweekly endocrinology gynecology collaborative clinic for those who have more specialized needs. Our breast imaging department is the only one in the Veterans Health Administration that has received the accreditation as a designated comprehensive breast imaging center from the American College of Radiology. Previously known as a Breast Imaging Center of Excellence, our facility has maintained this accreditation since 2014. Breast imaging services are also located in the Amethyst Clinic at the Carl T. Hayden VA. So this is in conjunction with our gynecology services, which has been really helpful for veterans with a one-stop shop who want to come in and get their mammogram screening as well as their gender-specific screening from gynecology. A facility is eligible to receive the ACR Comprehensive Breast Imaging Center designation only if it is fully accredited by the American College of Radiology in all of the following modalities. So mammography, stereotactic breast biopsy, breast ultrasound, including the ultrasound-guided breast biopsy module, and MRI accreditation in the breast module. Our breast imaging department is comprised of 2 full-time radiologists, a full-time rotating resident, breast imaging technicians, administrative support, and 2 full-time nurse navigators. And breast imaging services may include screening and diagnostic mammograms, including digital tomosynthesis or 3D, breast ultrasound, breast MRI, various image-guided biopsies, ductograms, as well as preoperative wire localization. And now I'm going to turn this over to Dr. Kennelly, who will discuss cancer screening.
Thank you. I alluded to some of these things earlier, but I wanted to go into a little bit more detail about some of the services we commonly provide here at the Phoenix VA. So in terms of cancer screening, these are applicable to birth sex females. The ones that we would routinely offer to our patients, cervical cancer screening, commonly people just call it a pap smear, that takes place from age 21 to 65. With normal results, it would be either every 3 years or every 5 years, depending on the technique that's used and the age. Younger than 30, it's typically every 3 years with the PAP alone. After age 30, it's typically every 5 years with the PAP and HPV testing. HPV is the virus that is responsible for most cervical cancer. Again, that's assuming normal results and people not at higher risk because of other medical conditions. Breast cancer screening with mammography, we typically do between the ages of 40 and 75. Colon cancer screening routinely between 45 and 75. I did ask for a little asterisk next to both of those because those are pretty strongly influenced by family history and genetic factors, also personal risk factors. So those might start at a younger age if you have high risk conditions or a strong family history. And the age of stopping screening is also pretty variable depending on a person's individual health. So routinely we stop at 75. But for somebody who is in good overall health, we might actually extend it longer than that if they have a good life expectancy and we think they'll benefit from screening. The last one is, well, colon cancer screening is also not gender specific, but lung cancer screening also not gender specific, but it would be something we would offer to our female veterans. We do have a low dose CT scan lung cancer screening program at the Phoenix VA. We offer it to veterans age 50 to 80 with at least a 20 pack year smoking history. So that's the equivalent of a pack a day for 20 years. And we offer it to people who currently smoke or those who have quit within the past 15 years. So those are the common routine cancer screenings that we offer for birth sex female veterans. Next slide. I did want to
Dr.
talk.
Kennelly, sorry
Yes.
to interrupt.
No, of course.
But we have a question. Do you need a referral for from your PCP to make any appointments for those kinds of services?
So if this is specific for the cancer screening, we do for mammography, it is self-scheduling. So patients who want to get a mammogram, they can call breast imaging directly to schedule. The primary care can also put in an order, and that can sometimes help facilitate the process, but that one is self-scheduling. For cervical cancer screening, I would recommend talking to your primary care doctor first if you are due or believe that you might be due for a PAP, and they should be bringing it up at your routine visits. But at this time, women can also call the Amethyst Clinic, which is where gynecology is housed, for cervical cancer screening. Colon cancer screening is a little trickier because that one would require either a colonoscopy or a stool test. So that one typically does require an order, although we do have a program in place that we are actively reaching out to people who are due for colon cancer screening. So if you're enrolled at the Phoenix VA and you're past due for colon cancer screening, you might receive a stool test in the mail to have that done. The lung cancer screening, that does require an order. We have a actual clinic that arranges the lung cancer screening and the follow-up. That's done within the VA, but it does require an order to get that set up.
Thank you.
Of course. So I did want to take a little bit of time to talk about some of the reproductive healthcare services that we offer. So some of these are more gender specific. We do cover sexual health services for our patients. This is something that does not, I think, get brought up enough, either by providers or sometimes by patients who may not feel comfortable bringing it up since it is a more sensitive topic. But we do offer evaluation and treatment of sexual dysfunction. So that is essentially any symptom related to sexual performance that is causing distress. So anything that's going on that is bothering you related to sex. The most common things we would see would be low sexual desire, inadequate arousal, lack of orgasm, and pain with intercourse. So those are all fairly common. And so if you're experiencing those symptoms, speak with your primary care provider. We also offer contraceptive management, which we get into in a little bit more detail in the next slide. And then I did want to bring up a relatively recent change in the benefits package with the VA. In September of 2022, interim final rule AR-57 was put in the Federal Register, which removed the restriction on the VA providing abortion counseling and services. Historically, the VA was not allowed to provide pregnancy options counseling or abortion services. With this rule being entered into the Federal Register, that restriction was removed. So as of September 2022, we are allowed to discuss pregnancy options. So when somebody comes in pregnant, we can talk with them about their options. So continuing the pregnancy and keeping the newborn, continuing the pregnancy and placing the child for adoption, or for those who qualify, abortion services. And we are allowed to cover abortion services in certain specific situations. And that would be a pregnancy that's the result of rape or incest, or a pregnancy in which continuing that pregnancy would endanger the life or health of the pregnant veteran. So in those situations only, we are allowed to cover abortion services within the VA.
Dr. Kennelly, we have a couple other questions. Are any of the services that you've talked about in the last couple of slides, are they available to veteran spouses, or is it strictly for veterans?
So the things I've talked about are for veterans. There are situations where spouses might qualify for care, but I will admit I don't know as much about that, so I'll try to keep my mouth shut a little bit. But there are some specific situations where spouses do get coverage. But in terms of, if there's a veteran who qualifies for care here, for the most part, spouses don't also qualify for care through the VA, unless, of course, the spouse is a veteran.
Thank you.
So I mentioned that the VA does cover contraception. And so if you are capable of getting pregnant and you want to discuss contraceptive options, I would encourage you to talk to your primary care provider to decide what's right for you. The VA covers basically any contraceptive options. So we have pills, which is what people think of most commonly, but we have patches, hormonal rings, the depot injection. We have the Nexplanon implant. We have both hormonal and non-hormonal IUDs. We do have emergency contraception, and that is available at all of our clinics. So in situations where a patient is not on birth control, or maybe has forgotten to take their birth control and had unprotected intercourse, we do also cover emergency contraception. Emergency contraception is not abortion. Emergency contraception prevents pregnancy. So that's something we've always provided, but that's available at our clinics or through the pharmacy to have on hand if needed in the future. And we also cover things like condoms, both male condoms and female condoms. That's something that many people don't realize, is we can also provide that. And then for patients who have decided that they are certain that they do not want a future pregnancy, the VA also covers sterilization procedures. So vasectomy for our male patients and tubal interruption procedures for our female patients. So we cover basically any option. And so I think if that's something you want to discuss, reach out to your primary care. Kristen mentioned earlier that we do also cover menopause management. 80% of women will experience menopausal symptoms, although far fewer will seek care for it. But if you are having symptoms of menopause that are bothersome, please, again, I'm going to say it over and over again, but reach out to your primary care provider to talk about options. We have hormonal options, hormone replacement therapy, which is the most effective treatment for menopausal hot flashes. But we also have non-hormonal options. There are some pills that can be given for menopausal hot flashes and other menopausal symptoms. So for patients who maybe have a contraindication to hormones, we do have non-hormonal options. And as Kristen had mentioned earlier, we also do have a sort of combined gynecology endocrinology specialty clinic every other week at our Amethyst clinic. They can help us out with some more specialized situations. So if somebody perhaps has a more rare condition, or for somebody who's not responding to the usual treatment for menopause, or they might have contraindications to the usual therapy, we do have that specialty clinic to help us out with that. So we have, like I mentioned, we try to handle things in primary care, but we do have support from our specialists when we need that. And then I did want to mention as well adoption benefits through the VA. Some people don't want to get pregnant, or some people can't safely get pregnant, and so that is not an option for them when they are family building. And so for certain veterans, they might qualify for reimbursement for adoption-related expenses. This is specific to veterans who have service-connected conditions that impact their fertility. But for those who do have those service-connected conditions, they can get reimbursement for the various fees that go along with arranging an adoption. So we have other options that are not just pregnancy specific. Next slide. And I will hand it off. Yep.
So now we'll talk a little bit about prenatal care services. And at Phoenix VA, we have 2 maternity care coordinators who are also registered nurses by background, and you'll see their contact information on this slide. So you might be wondering, how do I even get connected to these services? So when you first find out that you're pregnant, you want to let your VA primary care provider know, and this will allow them to enter a consult to the community. So you would get your prenatal care services at a community provider. And this website here allows you to go on and find providers that are in network with our community care network. And that is actually TriWest, which is different from TRICARE. Sometimes our community care providers do get confused, so it's really important that you note that it's for TriWest, that they accept TriWest. But we also have a community care department who will assist you in navigating that, as well as will the maternity care coordinators. So I won't go over all of the services that are covered as part of prenatal care, but just to outline a few, it includes outpatient appointments as well as treatment consultations, labor and delivery services, follow-up visits with your community care provider, and that does include postpartum contraception. After that 8 weeks of postpartum care with your community provider, it is expected that you come back to the VA and see your primary care provider for continuation of care. And new as of last year, our maternity care coordinators will follow you along in your postpartum journey through 1 year. So that's really an added benefit. And there is newborn coverage for the day of the infant's birth plus 7 consecutive days after that. Additionally, we do offer supplies and equipment, and your maternity care coordinators are there to assist you in that process, including a breast pump, nursing bras, and then there are also storage bags for human milk if you decide to express milk. Additionally, we offer 2 classes, one of them being Reach Out, Stay Strong Essentials. And this is a class to help you build skills and prepare for the changes that do come with a new addition to your family. So that is actually offered virtually, and it's in a group format. That's 4 sessions during pregnancy. And then we also offer a postpartum follow-up session just to check in, see how things are going, and if you need any additional resources. The maternity care coordinators also offer a nutrition and breastfeeding basics class, and that's offered with a registered dietitian. So they're able to offer nutrition insight to help support the pregnancy as well as breastfeeding if that is a avenue that you're looking forward to and participating in. Also, they offer newborn basics care as part of that class. Now, we also have about 200 pregnant veterans each year. So the maternity care coordinators host monthly baby showers with gifts for moms and babies. And those gifts are actually donated through community organizations as well. And I just want to mention really quickly about emergency care. We know that emergencies happen. So if a pregnant veteran were to need emergency care and they go to a community care or community emergency department, we absolutely ask that you call the VA and notify them, and the number is on this slide. The VA has tried to make it easy to remember by spelling out 72-hour VHA, and that's a nice reminder that you need to let them know within 72 hours that you presented to the emergency department, and that's either yourself as the veteran, a family member or friend, as well as hospital staff in that emergency department. And that's important because the visit must be reviewed in order for the services to be approved or not by the VA.
Megan, we have a question. Oh, sorry. Go ahead.
Go ahead.
There's a question. Are the
Sure.
classes for just the mother, or are partners also included in parenting support?
That is a really great question, and thank you for asking that. Right now, they are just for the pregnant veteran, but we do, if there are partners that are interested in any parenting support, we can help connect them to community resources as well.
Thank you.
And these flyers, I just want to share these flyers as well. So these are for the classes that I was just mentioning. The contact information is there on the slide, and we'll make sure you get these as well. But please reach out to Dr. Casillas, she's our women's health psychologist for the ROSE program, or also to your maternity care coordinator regarding the breastfeeding class. And I'll hand it back over to Dr. Kennelly.
Yep. I wanted to talk a little bit about infertility services that the VA offers. All veterans who qualify for care with the VA do qualify for care related to infertility, with the exception of IVF, in vitro fertilization, which we'll talk about in a moment. That is only specific veterans who qualify for that. But short of IVF, all veterans who qualify for care can get treatment for infertility. Infertility is when an opposite sex couple does not become pregnant after 12 months of regular unprotected intercourse. Although there are some situations where you might want to talk to your provider sooner. So that would be obviously same-sex couples and those with health conditions that would known health conditions that would impact their ability to get pregnant. The most common ones being polycystic ovaries or endometriosis. Also, female veterans over age 35, we generally get the infertility process rolling after 6 months rather than 12 months. So there are situations where you might get that care sooner, but broadly speaking, it's not getting pregnant after 12 months of regular unprotected intercourse. These benefits are available to all veterans regardless of service connection, gender identity, sexual orientation, relationship status, marital status. So this is, like I mentioned, this is available to all veterans. So regardless of your gender identity, whether or not you have service-connected conditions that impact fertility, these services are available. So what might you need in terms of evaluating fertility and attempting to build a family through pregnancy? We cover evaluation. That would be things like labs and imaging, for example. We cover pre-conception counseling, so discussing your health before getting pregnant, getting folks on prenatal vitamins, potentially genetic testing if there's reasons to do that. The benefits package covers hormonal therapies, medications to induce ovulation, fertility medications. It covers intrauterine insemination, and it also covers reversals. I'm going to mute to cough. Give me one. It also covers reversals of prior procedures. So if a veteran has had a vasectomy or a tubal interruption, the VA can actually also cover reversals. So if you do change your mind, you can talk with your primary care to get set up with the specialist to review reversal procedures. Next slide. So I mentioned IVF as its own special situation, and it is covered under a separate directive within the VA. So the only veterans at this point in time who qualify for IVF specifically are those who have a service-connected condition that impacts fertility. So a service-connected condition, adjudicated service-connected condition that has an impact on the ability to get pregnant. The veteran must be legally married to an opposite sex spouse, and the couple must be able to provide their own gametes, so sperm from the male veteran and eggs from the female veteran, or have cryopreserved gametes of their own. So let's say, for example, they had a surgery that removed their ability to produce eggs or sperm, that they have preserved those beforehand. And the female partner has to have an intact uterus. So those are the requirements for IVF. That is potentially changing. The DoD, Department of Defense, is potentially expanding that beyond just that group, and so that may change in the future, but at the moment that's the requirement. IVF, for those not aware, is the manual fertilization of an egg with a sperm outside of the body and then transferring that embryo to the uterus. So again, it is potentially a covered benefit, but you have to meet specific criteria in order to qualify for IVF, whereas all other fertility services are available to all veterans. Thank you.
Thank you, Dr. Kennelly. So before we begin talking about mental health care services, I just want to recognize that this can be a pretty sensitive topic. So we ask that you be mindful of how you're feeling, and please reach out to your provider or trusted loved one if you are experiencing any adverse reaction to anything that we discussed today. And if you're currently in crisis, please call the Veterans Crisis Line at 988 option 1, or you can text 838-255. Additionally, you can also chat using the veteranscrisisline.net.
Megan, can I interrupt just for a second before we proceed to mental health? There is a question about, are there any services related to surrogacy or just adoption?
I'm not certain about that, so I don't want to say something that's wrong.
Yeah.
Go ahead.
Oh, sorry. So surrogacy is not a covered benefit. The VA
Yeah.
does not, cover surrogacy at this time, but that could be something that they're considering for future.
Thank you.
You're welcome.
Thank you. So I'll review a few of the Phoenix VA mental health resources, and please note that this is not exhaustive by any means, but we also just want to let you know that services offered through Phoenix VA are evidence-based. So what this means is that there's research to show that treatment is effective and can help decrease symptoms, or at least show improvement in the symptoms that someone may be experiencing. Services are also offered in person and virtually, and again, may be available in an individual or group format. So you may be wondering, how do I get started? So if you are already enrolled in Phoenix VA for healthcare, you can contact mental health services yourself, and the phone number is there, or you can also speak with your primary care provider, and they can help you by entering a consult. Additionally, we have primary care mental health integration, which is part of your patient-aligned care team. So let's say, for example, that you go in and you see your primary care provider, and they note that you're feeling more stressed, you're having trouble with sleep, and you're not eating as much, then they may ask you if you want to speak with somebody in mental health, and that's where you could see them same day. And you can also ask your primary care provider if you're there and are wanting to speak with somebody. Additionally, we offer psychiatric services, which is available if you're seeking medication assistance to help manage any mental health symptoms that you may be experiencing. Now, I just want to mention health psychology as well, and these are just a few examples. So this is available if you're having any difficulties with sexual health, for example, difficulties with sleeping, adjusting to a new medical diagnosis, or experiencing chronic pain, among others. We also have specialty mental health care, so treatment is available for post-traumatic stress, disordered eating, LGBTQ+, as well as substance use, disorders, among others. As well, We also have an MST clinic and coordinator. About 1 in 3 women and 1 in 50 men have told their healthcare provider that they've experienced sexual trauma in the military. And services related to MST are offered without a copay. And services are also available to service members who may have left service with an other than honorable discharge. And while we have included it under mental health care, we also just want to recognize that some people who've experienced MST may also have an impact on their physical health, including headaches or chronic pain, GI difficulties, and more. And the MST clinic is a specialty clinic, so it provides therapy options to help reduce those trauma symptoms that you may be experiencing from sexual assault or sexual harassment while in the military. So it is trauma focused. So providers will work with you to help reduce those trauma symptoms that may be a result from those emotions that are connected to those memories and to help fully process those experiences. And we recognize too that that might be too much at first. So for individuals who are not quite ready for that level of treatment, then they can receive services in other mental health programs as well. And again, you can self-refer. The number for the MST coordinator is listed on the slide, or another provider can assist you by entering a consult as well. We also recognize that veterans experience intimate partner violence at a higher rate than the general population. And so we do have a coordinator as well as a couple of programs to help individuals who may be experiencing or using violence in their relationships. So we do have the RISE program here at Phoenix. I do not believe that it's available at all VAs yet, but it is an individual program for individuals who are experiencing intimate partner violence. And the Strength at Home program is for individuals who may be using violence in their relationship, and that's offered in a group format. You're able to get connected to this program by speaking with the coordinator or also speaking with a member of your healthcare team, and they can also help connect you to resources in the community as well. We also have a full-time women's health psychologist, and she offers gender-specific care to help address reproductive mental health across the lifespan. So that could be anything from family planning, adjusting to pregnancy and the postpartum period, perimenopause and menopause transitions, as well as life changes, stressors, grief and loss, and depressive and anxiety symptoms as well. We also have an LGBTQ+ veteran care coordinator, and they offer a health education group and is also available to help navigate the healthcare system as well. Now, I just want to go over a few crisis resources. I know I've already mentioned a little bit about the Veterans Crisis Line, but I also just want to note that you do not have to be enrolled in VA healthcare to use the Veterans Crisis Line, and family members and friends are also able to call the crisis line if they have a concern about a veteran in their life as well. And that number again is 988 option 1, or you can chat online at veteranscrisisline.net or text as well, 838-255. And of course, there's the emergency department or by calling 911. And again, we just want to highlight pretty much anytime you go to the emergency department, that's not the VA emergency department, you need to notify the VA within 72 hours. And that number again is 844-724-7842. And we've included the National Domestic Violence Hotline on here as well. It's 24/7, and they're able to connect you to local resources and emergency resources related to any intimate partner violence that you may be experiencing. And briefly, you may have heard about the Compact Act. It's of 2020 and was actually enacted last year. And this act states that the VA will provide, pay for, and reimburse for emergent suicide care for eligible individuals at VA medical facilities and community facilities. So when I say emergent suicide care, I mean that the individual is at imminent risk of self-harm or unable to maintain their safety due to suicidal ideation. So what this act does is that it also allows for appropriate referrals to be made for follow-up care, determines eligibility for other VA services, and also refers eligible individuals for appropriate VA benefits following that emergent suicide care. Again, it's really important that you call the VA within 72 hours to let them know that you are in the emergency room, even if you are not enrolled in VA healthcare. And this really helps to start that process to determine eligibility for care. There may be some rare circumstances when individuals are ineligible. So I have included the Compact Act coordinator's phone number, just in case you have any questions regarding eligibility. Not all VA healthcare systems have a Compact Act coordinator. But if you have any questions regarding eligibility, the patient advocate is able to assist as well. Now, lastly, I want to mention the Vet Center, and they are available in each state, and they operate separately from the Veterans Health Administration. So Veterans Health Administration staff cannot see the Vet Center records, and they offer mental health services and are also open to family members as well. Eligibility requirements do apply, and I definitely encourage you to reach out to them if you have any questions about their services and if you are eligible. And those links below will connect you to the local Vet Center closest to you. I'm going to go through a few slides of flyers. We have our MST clinic flyer. And if there's anyone outside of the Phoenix area, this Intimate Partner Violence Assistance Program flyer is helpful just if you're interested in more information. And it has this link where you can go to find your local IPV coordinator as well. And we have our mindfulness-based stress reduction for women veterans, and this is run by our women's health psychologist. And we have a pain management group. This one is specifically for women veterans, and there are also some mixed gender groups as well for people who may be experiencing chronic pain. This flyer on the left is the health education group for LGBTQ+ veterans, and on the right is a drop-in group for women veterans. So you just need to register, and if you're interested in any of these groups that are offered, just make sure you contact the person listed. And I will make sure you have these as well. Do we have any questions so far?
I have a question. I've noted that, and these are all great, but a lot of us work. And so do you have any after hours kind of groups?
So that is a really good question. The Vet Center has a lot of more opportunity to participate after hours. And Kristen, I don't know if you want to jump in as well regarding during business hours.
Yeah, so I think that one of the challenges that we have locally is just ensuring that there is participation, that we have adequate participation to offer a group. And so that's been a challenge. I know that when there have been groups offered after hours, there's not consistent attendance, and they have to have so many veterans attend in order to continue with that group. So as long as we can get that attendance up and maintain that attendance, then we can start offering some of those groups. But at this time, I think with the flyers that you have here, generally these are going to be offered during business hours, but I think that there's always an opportunity to speak with those facilitators to let them know that there would be more, if there is more of an interest in an after hours group.
Thank you.
You're welcome.
We do have a question in the chat. We have, is a virtual peer support type group after hours an option?
That is a really good question too. So thanks for asking. An after hours peer group. And so I think that that is something that we can look into. I know that Carol Tucker is one of our peer specialists over at the 32nd Street who's offering that drop-in group. So we can talk with her to see if that would be a possibility. Thank you for that question.
Okay, so I know that we have a lot of participants who mentioned that they were already enrolled in VA healthcare. And so for those who are not, we just wanted to provide some information on how you can apply for VA healthcare. So you can apply online, by phone, by mail, or also in person. For the individuals who are joining us from the Phoenix area, we have included the in-person locations where you can come in and apply. And the documents needed to apply include your discharge papers as well as the VA form 10-10EZ, and there's a link here to that form. And we really encourage you to apply even if you are unsure of whether or not you are eligible. And there's also this latest information that is hot off the presses that the PACT Act is expanding eligibility and for VA healthcare on March 5th, so just next week, to these veterans listed here. So veterans who served in the Vietnam War, Gulf War, Iraq, Afghanistan, or any other combat zone after 9/11, veterans who deployed in support of the global war on terror, or veterans exposed to toxins or other hazards during military service, and that includes individuals who may have been exposed in the US as well as part of their military service. And here's a link as well if you have additional questions about that and want to learn more. Pausing for questions.
Okay, and you would need to be honorably discharged, correct?
So eligibility and applying is very tricky. So I would encourage you to apply, and that's where your DD 214 would come in and speak with eligibility.
I
To
think
apply
too,
or- go
I
ahead.
think too, that there is a classification for those who are discharged under other than dishonorable. So that is another classification. But again, as Megan mentioned, that you'd want to reach out to eligibility directly because it is such a tricky topic.
But thank you for that question. It's a really good question. I'm sure many people have that same question. But definitely apply.
We have another question. Who or where would we go to find out about veteran spouse health care? I'd like to add, if the spouse is a spouse of a deceased veteran, does that make a difference? And I don't mean just deceased, but killed in action, one of those kinds of eligibilities.
I mean, I would encourage speaking. Usually the best starting place would be like the VA regional office. There's folks you can talk to there about whether they qualify. It's not many folks who qualify for spouses who qualify. There's a program called CHAMP VA, but you'd really need to speak with the eligibility folks to see if a spouse qualifies. So working through the Veterans Benefits Administration, and again, the regional office, which is on Central Avenue, is oftentimes a good place to start. So I would encourage talking to those folks.
Thank you.
And we also want to invite you to attend some of our upcoming events. Our next one is actually coming up this Monday. So if you are enrolled in Phoenix VA for healthcare services and you're using our behavioral health services, please reach out to me. We're hoping to learn from you about your experiences with behavioral health services, what's going well, what might need improvement, and what we can do to make things better for you and other veterans using the system. So our next one's March 4th, and there's another opportunity if that's too soon and you need more advance notice for Tuesday, April 16th. And then we also have our next town hall coming up on March 28th, and this is an opportunity to ask questions about facility leadership and also hear from subject matter experts regarding various health services. And that'll be March 28th, and you can join online or by phone. And this next slide is just a few resources. We didn't want to totally inundate you and overwhelm you. So on this left-hand side, there's the She Wears the Boots podcast. This QR code will actually take you to the link so that you can listen. And this is put on by the National Office of Women's Health about the various women's health services available within the VA. So it's really a great way to stay up to date on what's happening in the VA and what's new with VA healthcare services. And on the right-hand side of the slide are some links to, this first one is eligibility and applying for VA healthcare. And this next one below it is the Women Veterans Call Center. And this will connect you to representatives who are experts in women's health. And they can even help you with enrollment if needed and connect you with your local Women Veterans Program Manager if you're from outside of the Phoenix VA. Additionally, if you're looking for more information regarding women veterans healthcare, this website will give you a plethora of information. And if you're looking for additional information about mental health services within VA, there's this link right below it. And if you're already using the VA, but you're not yet signed up for My Healthy Vet, we encourage you to sign up and also upgrade your account so you can communicate with your providers, your healthcare team, and also review your medical records and track your medicine. And if you just want more information about the Phoenix VA itself, here's this website as well. And now I believe we're going to have one more poll.
After all of that information, hopefully everyone chooses to. It looks like, there we go. 50-50. Oh, no, still voting. All right, and we will end the poll now. And so it's good results.
All right. And lastly, Megan and I just wanted to share our contact information. Should you have any questions as a follow-up to today's presentation, maybe you're not thinking of the questions and you think of them later, you're welcome to contact us. You can reach the Women Veterans Program at extension 6764, or you can reach myself directly at extension 2272, or Megan directly at extension 1538. So she and I both have access to the Women Veterans Program extension, and that's just a great general information voicemail that you can leave there. Next slide. And then lastly, we just want to say thank you so much for allowing us to come speak with you today to present the services that are offered to our women veterans at the Phoenix VA. Again, these aren't comprehensive slides on all the services offered, but they are really a really good snapshot of some of the primary care services, whole health services, and some of the specialty care services, as well as mental health that we're offering here. And we just wanted to take this time to answer any outstanding questions that you might have.
So does anyone have any additional questions of our 7 attendees who are still here with us? No? Yep, we got one. Oh, it's a thank you for the presentation.
Nan, yes, thank you.
Thank you for joining.
All right, well, if there's no more questions, I just want to thank the VA, particularly Kristen and Megan and Dr. Kennelly for just supporting us. It's really nice when we can have education about women veteran issues. You know, when a lot of women, I think, don't necessarily recognize themselves as veterans. And when they recognize how many more, I mean, all the IVF and fertility and all that stuff, I didn't know you had all of that. And so it's really nice to know that they're, I mean, really very much more comprehensive than it used to be. And it's helpful for this fastest growing cohort of women that are coming at us now, right? So it's really, I think, great for you to share this information with us and actually to be with us for this hour. And I think we got 2 more questions. Let's see.
They're just saying thank you and
Yes.
preach. So I did want to say, you know, the reason we had this is just, it was personal to me because I had 2 children. I had not ever gone to the VA for over 20 years after I left service. And so I had 2 children and I had to end up filing bankruptcy over it. And I just feel like, I wish all veterans knew that they could get such wonderful resources for maternity care and, you know, nursing, and I mean, just everything. It's just, I'm in awe of what's available. So I just hope that everybody can reach out and maybe send this over to a friend, because we're going to have this available. We've recorded this. We'll have it available for somebody to watch later on. You can find it on YouTube. I'll have it uploaded tomorrow. We want to make sure that everybody knows that this is what's available now today. Things change the VA. So I will have that in there. But if anybody wants to share this with any family members or people they know who are women veterans who could use the information, we will have it on our on YouTube.
And I would encourage those who said no about enrolling in the VA, rethink that. I'm 61 years old now. And man, those pains from being in for 26 years are starting to creep up on me. And it's nice to know the VA is there to help me. And I have TRICARE because I retired, but I still use the VA because they have great services there.
Thanks, Wanda. And one of those areas that the VA is looking at is also musculoskeletal injuries. We know that that's a really common condition
Yes.
experienced by our women veterans. And so there's specialized training now at the national level to send our providers to that MSK conference so that they can receive that specialized training to help support women veterans with those injuries.
And I know that a lot of us have them. So use the VA. And I think
Thanks
we'll
for the
close
plug.
out on that. Great. Thanks,
Cyn-
everybody.
Cynthia did have a comment. She just said, thank you. She uses Whole Health and has an amazing health coach. Great to know all the other info too. And then another one said the VA is my only healthcare. So we really appreciate everybody that came and got more information. And a lot of the people that were a part of this conversation work with other veterans out in the community. So we just want to spread it as far and wide as we can and invite everybody to make sure that they get this information out to the community.
Great. Well, thanks to the participants, and thank you again for spending time with us today to educate us about VA healthcare. And hopefully we
for
can do it
having us.
again.
Yeah, I hope so.
Thank
Thank
you.
you so much.
You're welcome.
Have a great evening, everyone.
Thank you.